Hello listeners, a warm welcome to Views on Health. With me in the studio tonight is Dr. Manitha Perera, consultant physician, who has taken time off his busy schedule to be with us on the program Views on Health. And as a consultant physician, Dr. Manitha Perera wants to focus on non-alcoholic fatty liver disease. While extending a warm welcome to you once again, Doctor, to our studios, a non-alcoholic fatty liver disease. Does it mean that fatty liver disease can present itself because of alcohol or even without alcohol? Over to you.
Yeah, thank you very much, Fatima. So, non-alcoholic fatty liver disease is commonly known as NAFLD, and this is a common condition these days, essentially meaning there is fat deposition in our liver and in patients without significant alcohol consumption. So as you asked, fat deposition can occur with alcohol consumption as well. So this is why it's called non-alcoholic fatty liver disease. So obviously it is in patients without significant alcohol consumption. And also we diagnose this after excluding other common as well as known causes of liver disease. So this is a broader terminology. And although we consider this is to be a liver disease, it's quite a multi-system disease. And we will, as we go along, we'll discuss about, the wider implications of this disease at the liver as well as beyond the liver.
Thank you, Doctor, for that introduction. But now when you, the topic says non-alcoholic fatty liver disease, and you did say that in response to my statements that it can be even due to alcohol. Are patients then basically because A has fatty liver disease because of the fat deposits, and B has fatty liver disease because he or she takes alcohol, whichever way?
Yes.
Or can it be both? A person can have the fat deposits because of the fat content intake or whatever, the way it forms in the system, in addition to the alcohol intake.
Yeah, good question. So let me put it in this way. I mean, we all have, we will be talking about the risk factors, so we all can have that element of non-alcoholic fatty liver disease in our background with our lifestyle. So in addition, if you are consuming alcohol, as I told earlier, it can cause fatty deposition, which is called alcoholic fatty liver disease. So a person who's taking alcohol as well as having a sedentary lifestyle with all the metabolic problems can have shares of both diseases causing fatty deposition. But unfortunately, there wouldn't be an absolute, measurement to separate which fraction causes which amount of fatty deposition. So generally, if a patient is having a significant alcohol consumption, there's a way we quantify that in medicine. I'm not going to go into the technical details there. But then again, if they have significant alcohol consumption, then we take it as a predominant alcohol-related disease, and the perception about management will differ according to that etiology. And the rest of the people who don't have a significant alcohol consumption will fall under the bracket of non-alcoholic fatty liver disease, and then we will be managing them accordingly. But always, time to time, even after diagnosing non-alcoholic fatty liver disease, in each follow-up, we will be asking them the question about their alcohol intake, whether they have changed their habits. So these things might come into decision-making when it comes to management.
Doctor, now a question that I want to ask you here is that which age group do you see? You want to focus on this topic because you think it's important to let our listeners know about a condition that you're dealing with. So I assume it's pretty common. You're coming across a lot of patients with this condition. In which case, like which age group that you see mostly that present with this?
Yes. So non-alcoholic fatty liver disease is quite common. If you look at the burden of the disease in Sri Lanka, it can vary anything between, 30 to even more than 60% in certain studies. It's quite prevalent. And in some of the studies which are done with, ultrasounds which are done for other reasons, sometimes you have noticed a wider population in this country is having fatty liver disease. And this is more common in the urban areas. But however, even the rural areas, we see this pattern nowadays. If you look at the age groups, anyone can be vulnerable. So even children can be there with non-alcoholic fatty liver disease. as well as it's quite common among the adults in Sri Lanka, because the risk factors would be things like diabetes and all, which are quite common. And we will be discussing about the risk factors. So it's quite a common condition and can affect a wide spectrum of age groups from childhood to adulthood up to elderly age groups.
So what brings about this condition?
Yeah. So before stepping there, I'll slightly explain what are the categories of this disease, as well as what basically happens there, and then we will move to the causes of it. So essentially, what happens there is fat deposition in the liver cells, and there can be multitude of reasons behind this. But then again, if it just deposits without causing much of injury, it is the initial simple fat deposition phase. Subsequently, certain patients move on to a more aggressive form of the disease, which we call non-alcoholic steatohepatitis. In brief, we call it as NASH. Now, if you hear your doctor telling this form, there's a bit of an aggressive form which can lead into much more complications. So that is essentially your liver is having fat as well as it is inflamed. That is, cells are in a sort of an angry mode because of the injury. And then if you don't do anything about this condition at this point, this can move on to, fibrosis. That is sort of an end-stage situation where your liver will start to fail. And I'm quite sure you have heard about a condition called cirrhosis. So essentially, this can even lead to cirrhosis if not tackled properly. So these are the stages. And this fat deposition can occur due to, there can be a genetic push into this. Some people are more prone to this, especially being South Asians. We are again slightly more prone to this, as well as with our lifestyle, these things can happen. So several hormonal changes like insulin hormone, which is needed to control your sugar. There's a resistance with body weight. So these are the mechanisms that lead to a non-alcoholic fatty liver disease. So moving on to the risk factors, one of the main important things is obesity, which is quite prevalent in our country. So overweight as well as obese people are more prone to develop non-alcoholic fatty liver disease. So that is one of the, I would say, main risk factors. And then other metabolic risk factors. If you look at diabetes, it is now, we have estimated in recent studies that every 1 in 4 adults in Sri Lanka is actually suffering from diabetes. That is about 25%. So diabetes is a risk factor. And then also high cholesterol, as well as hypertension, high blood pressure. Collectively, we call these risk factors, when they are present together, as metabolic syndrome. So these are quite prevalent in our country. So these are risk factors for non-alcoholic fatty liver disease as well. In addition, you might have heard about a condition called hypothyroidism, that is underactive thyroid. So patients who are having underactive thyroid, both diagnosed as well as undiagnosed patients, have a higher risk of developing non-alcoholic fatty liver disease. Then also polycystic ovaries. This is a disease of females. So this is a hormonal imbalance. Again, these patients can develop a non-alcoholic fatty liver disease. And so there are many reasons which can lead to a non-alcoholic fatty liver disease. Sometimes even certain drugs can increase your risk for a non-alcoholic fatty liver disease. So these are the risk factors basically which we are trying to look into.
So a person who has this condition, what will he feel to begin with?
Yeah. So mostly these patients can be asymptomatic. That is where it gets trickier. So patients can have no symptoms absolutely and have a significant fat deposition in their liver. So if you check for the symptoms, the people who develop symptoms, it will be sometimes a non-specific thing as fatigue, sometimes pain in the right upper tummy, and sometimes some people even might complain dyspeptic symptoms like gastritis, but nothing specific as such. Most of the time this is picked up by your doctor when they examine your tummy for something else, by an enlarged liver sometimes, or when you have undergone liver blood test or scan for some other reason. Sometimes patients come and say, "Doctor, I underwent a scan to see whether I have kidney stones because I got a tummy ache." And the doctor told there are no kidney stones, but my liver is having fat. So similarly, it can present incidentally with tests done for other, conditions. But if this goes undiagnosed and advanced in stage, then if you move on to liver failure stage, then you might start to develop your swelling in your legs as well as tummy, as well as sometimes itchiness in your body, yellowish discoloration of the eyes, sometimes urine, And very advanced stages, their memory, their cognition might also change. Now, this is a very advanced stage of cirrhosis. And finally, and unfortunately, this is a risk factor for liver cancer. So sometimes some patients, they present in their adulthood with liver cancer, and when you look into the causes, you can't find anything. No hepatitis history, nothing of that sort, no alcohol consumption, no family history, but they have liver cancer, and this is because of the progression of previously unknown non-alcoholic fatty liver disease. So this is not to panic, but then again, you should remember that this is a condition which is not totally benign. You have to take it serious and reverse it, and we will discuss about it in the due course.
So is it treatable?
Yes, very much. That is a good news. So first of all, I will tell how to diagnose it. So the liver enzymes, if you happen to do the common test, even the lay people know SGOT, SGPT, these enzymes can be high. But what you should bear in mind is these enzymes can be normal and still you can have fatty liver disease. Secondly, if you have done an ultrasound, either targeted one or incidentally for another reason, your doctor can detect fat deposition and they can even comment on the severity. So that is another thing. So if you want to follow, in certain cases, the doctor might ask you to do something called elastography. That is a kind of, again, nothing, pricking you. It's a scan, but then it is to see the liver stiffness. That sort of tells you the grade of fibrosis without actually needing a liver biopsy. So it is a quite a handy test, but it is done only for certain patients. Then if you want a confirmatory diagnosis, this we don't do for all the patients, but then liver biopsy. Essentially, you take a tiny part of your liver and they put it under the microscope and see what are the causes of these diseases. And as I told you earlier, you have to exclude the other causes before you diagnose non-alcoholic fatty liver disease. So doctor might order tests for hepatitis screening, tests for other known and common liver diseases, for example, like iron overload, so on and so forth. And in addition, for risk factors, your doctor might screen you for diabetes, high blood pressure, your lipids, even your thyroid function. So that is the sort of approach you take to diagnose. It is mainly a clinical diagnosis.
So end of the day, once diagnosed, and you said it can be treated, it can be totally treated, or is it something that can recur?
Yeah. So it can definitely recur, because if your lifestyle is not good, it will recur the same way it occurred. So treatment-wise, initially I told you that this is centered around the body weight. It's common among people with high body weight. Having said that, it could be there even in lean people, a condition called lean NAFL. I'm not going to go into that area. So weight reduction is quite important. So what we would suggest people is to have regular exercises, cut down on their fat in their diet, also the carbohydrate content. We being Sri Lankans, we eat a lot of carbohydrates, so we have to cut down on that as well. So your doctor might give you a target like 5 to 7% or 7 to 10% reduction of your weight in the coming 6 months. And we might also refer the patients to a specialist nutritionist to achieve this course. So weight reduction is very important. With that, we see a good response in their liver enzymes coming down and their fat deposition in the liver also regressing. Sometimes enlarged liver can also shrink to the normal size. So this is the sort of center step in management. So weight management and healthy lifestyle. And also you have to cut down on your, alcohol intake, as well as smoking is bad because these metabolic risk factors can cause you heart attacks also, so smoking is bad. So these are the things broadly that you do. So if you fail to achieve this weight reduction by your lifestyle modification as well as the dietary manners, then there are some medications your doctor might use, both tablets, sometimes in developed countries, even in Sri Lanka now, certain injections are available to help you with, reducing the weight. Failing all of that, and also if your weight is extremely high, we might look into surgical options like bariatric surgery. But these are going in a stepwise manner with a, continual input from your, doctor as well as bilateral discussion with patient. So it is a stepwise, it's a journey. It's not something that you give one-off tablet and settle. Secondly, targeted treatment for fatty liver disease. There are some new therapies, but then again, sometimes vitamin E is used for certain subpopulation of patients, not for everyone. And then there are other medications, especially your diabetic medications, if you are a diabetes patient, as well as suffering from non-alcoholic fatty liver disease. Things like metformin, pioglitazone, there are some treatments that your doctor might select depending on your, risk factors and your medical conditions. And also your doctor will immunize you for future hepatitis and take care of your, liver from other insults that can sort of contribute to ongoing liver damage. So these are the sort of approaches you take targeting your NAFL. But then having said that, we told that the risk factors for this is diabetes, your cholesterol, your pressure. So obviously your doctor will liaise with you to control your blood sugar and your pressures as well as your cholesterols as a part of management of non-alcoholic fatty liver disease. So yes, it can recur, but you can control it. So it's all about healthy lifestyle and going a journey with medical advice.
Doctor, it might be difficult to say, but approximately how long would it take to treat a patient to totally overcome?
It is as you said, it varies with person to person. Your severity of it's very difficult to give an answer like that because, for example, a young lad who has time to go to the gym and commit to exercises maybe 5 to 6 days per week for long hours against even a doctor for that matter or an executive who's working long hours in the day, patient might right away tell, yes, I can understand doctor what you say, but I don't have time to commit for this amount of exercises. I'm not endorsing that is the right answer, but then again there can be practical issues, so different people will put different time into this regime, so their time to recovery will both depend on the disease factors and patient factors. And also, even after putting the same time for this, treatment, different people due to their genetics can come out slowly. So it varies from patient to patient.
So, and like you said, it can recur if they don't follow a proper lifestyle thereafter.
Yes. So if you were 90 kilos of weight and your doctor say you have fatty liver, and then you put all the effort, dietary modifications, exercises, treatments, and then you reach your target weight. We have said for their height it's 65 kilos, and then you see a good improvement in your liver. And then subsequently, if you lose the grip of it and then you come back to 90, all these things will return. So it's a lifelong journey to maintain good health. Actually, fatty liver disease is one area that sort of reminds you the importance of or the broader benefits of lifestyle measures in health.
Now, once this condition sets in, I'm not going as far as cirrhosis, but will there be any damage to the liver, to some degree even?
Yes. So as I told you, according to the phases of the disease, simple fat deposition, probably if you tackle it at that point, probably you can get away with minimal harm. But if you go to that NASH, that aggressive form I told you, then of course there is a liver injury. And some of it might be, partially or residually remaining even after recovery. But that having said that, what is important is to tackle it at least at that level rather than going into cirrhosis. So at any point in your disease, tackling it is better than losing the grip totally and letting it go to the liver failure, and in the worst case scenario, even liver cancer.
So surgery, does it play a role?
So non-alcoholic fatty liver per se, we don't have, surgical treatments. But as I told you, if weight management becomes trickier due to multiple reasons, then bariatric surgery can give you good results. But then it's a very complex surgery done by a specialist after, consulting the patient for the surgical risk factors, what to expect. So it's a very complex thing. Your doctor will take you there stepwise if it is absolutely necessary.
Doctor, when you talk of the liver, from what we know, from a lay point of view, is that the liver grows. Because when somebody has a liver transplant or donates, the liver grows. So in that respect, how does that work with when the fatty liver disease is set in?
So liver grows in the sense it is to mean that liver has certain amount of ability to regenerate and recover. That is what it technically means. So similarly in NAFLD, as I told, if you tackle it early, your liver will recover. And if you maintain that lifestyle, that recovery will be long lasting. But having said that, if you have progressed to the cirrhosis stage where fibrosis has set in, now that is an irreversible stage. At that stage, your liver has lost all its ability to regenerate and recover. So you will be in end-stage liver disease necessitating transplant. And if you look into Sri Lankan liver transplant, most of the people who get listed for liver transplant are commonly having NAFLD-related liver disease, because although we are in the Indian subcontinent, compared to rest of the countries, hepatitis B and hepatitis C is not that common, fortunately, in our country. And leaving aside alcoholic etiologies, one of the commonest causes for liver transplant referrals is again NAFLD, and we should remember this can affect females as equal as males. So no one is actually safe from NAFLD unless we embrace healthy lifestyle.
Very interesting, doctor. So it's a question of basically taking care of your health from the very beginning. Now, what is it that makes the patients really come to this situation where they have the fatty liver disease? It is, you spoke of being obese, yes. But what about the obese comes with eating unhealthy food and large quantities. Take children. Can children also get this condition? Rarely,
yes.
But it is there.
Yeah.
So that again, is it only obese children or is it any other sort of a child who can be lean? I have come across people who are slim but to have fatty liver disease.
Yes, exactly.
So
regarding children, children can develop fatty liver disease. I'm not going to go into detail because it's outside my specialty. But regarding the question whether obese people are the only people who can develop this disease, I think I briefly mentioned earlier a category called lean NAFLD, lean non-alcoholic fatty liver disease. Now, because you asked this question, I think it's quite relevant. So let's talk a bit about it. So lean people can also develop NAFLD, and they can have the same risk factors, although they are not obese. Where it gets trickier is when you're obese, even people nowadays, lay people know I might be having a little bit of fat in my liver. They go to the doctor. Sometimes even doctors, when they walk into their consultation, you think, okay, this guy is obese, he might be a fatty liver. You check for them. Lean people are the fatty liver disease that goes under the carpet, missing. So sometimes, unfortunately, it's a paradox. These are the people who first present with sometimes liver cancer. So yes, lean people can develop fatty liver disease.
Thank you, Doctor. Time has caught up with us. What's your take-home message?
Yeah, so fatty liver disease is beyond liver. So it is having broader implications to overall health. Therefore, I think a healthy lifestyle, exercise, good food can take you a long way on fatty liver disease as well as in your general health.
Exactly, doctor. That's very important because end of the day, if you're careful, it helps you overall. And there we end this very interesting discussion on non-alcoholic fatty liver disease. Thank you so much to you, Dr. Manitha Perera, consultant physician, for being with us on the program.
Thank you.
My thanks also go to Damayanti Kolumbage for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.